In this video, I will be discussing the negative symptoms of schizophrenia. The negative symptoms of schizophrenia are disruptions in normal areas of functioning. These symptoms are also sometimes referred to as depressive symptoms because these symptoms are also very commonly seen in clinical depression. Let's begin with what I refer to as the 5 A's: anhedonia, flat affect, avolition, alogia, and apathy. Let's start with anhedonia. Anhedonia is defined as the inability to feel pleasure. When in this state, individuals will report that they don't really enjoy doing anything. Imagine someone who spent their entire life loving the game of soccer, and that their favorite thing to do when they had free time was to play soccer. When you're in the state of anhedonia, even doing your favorite thing doesn't give you any pleasure. Next, we have what's called flat affect. This refers to one's facial expressions. When somebody presents with flat affect, this means that they express little to no emotion on their face. And so their emotional expression is literally flat. Next, we have what's called avolition and apathy. I want to talk about these together because they often occur together. Avolition is what we define as a lack of drive, not having the desire to do anything, including things like washing oneself and brushing one's teeth, getting up out of bed to go to work. This often coexists with a state we refer to as apathy, which is simply a lack of interest, not really caring. Individuals, when in these states, will have thoughts like, what's the point? I don't care. Why even bother? So hopefully at this point it is clear to you why these are often referred to as depressive symptoms. Okay, finally we have what is called alogia. This is defined as a poverty of speech. Individuals who are presenting with what is called alogia say little to nothing. If you enter into conversation with them, they may reply, but their answers tend to be very to the point and concise, with little elaboration. Beyond the 5 A's, there is one more negative symptom that is commonly seen in patients with schizophrenia. This is what we call social withdrawal. Individuals who develop schizophrenia very frequently will begin to isolate themselves and withdraw from their friends and family and other loved ones.